Everybody can hear okay? Good. Okay, well, good morning, and thank you all for being here for what I think and what I hope will be our last media briefing from the Metropolitan St. Louis Pandemic Task Force. I also want to thank the numerous public officials, healthcare professionals, and others that are here today and have been with us throughout this entire process. Your expertise, leadership throughout the pandemic have been incredible. You volunteered to do whatever was needed, whenever it was needed, and for that, I and the rest of the task force leadership team are forever grateful to you. Now, I want to be very clear about one thing today, however, and that is the pandemic is not over. But we're entering a new phase, one that we can manage more effectively and safely than we were able to when the virus was raging. We'll talk more about where we go in the next few months, but first let's look at where we have come from. A little more than 14 months ago, the St. Louis Metropolitan Pandemic Task Force was established to help us prepare for a once-in-a-lifetime challenge of largely unknown, highly contagious virus that led to widespread death and destruction. I'm going to make sure that this is going to change here. Sorry, guys. In many ways, 14 months seem like a lifetime ago, and we'll never forget the headlines. We'll never forget the uncertainty we felt as this pandemic began. There were so many things that we did not know, but some things were very clear. We knew our hospital systems and healthcare staff would be overwhelmed if we didn't take dramatic action. We knew that any action we took had to be coordinated and had to be a collective effort. If just one county, one city, one health system acted alone, it wouldn't be enough to address this challenge. We knew we had to work together. We also knew that we were dealing with a virus that was extremely unpredictable. Even in April of last year, it was becoming clear that some COVID patients would have very minor symptoms, while some would end up on ventilators and some would eventually die. In short, we knew that we needed to act. We needed to act together. We needed to act quickly. And I'm very proud of the fact that the region did act quickly and came together to combat this threat. Now let's take a look at roughly a timeline of the pandemic within St. Louis. Oh, I apologize. Let's take a look really quickly at the timeline of the pandemic in St. Louis. In March, we had our first confirmed case of COVID. 2 weeks later, we lost our first patient to the virus. On April 4th, we held our first press conference to discuss the task force and to help prepare for what was coming. In July, St. Louis City and St. Louis County initiated mask mandates. And in November, we began our darkest hours, where we peaked in daily admissions. And in December, we saw more than 900 patients hospitalized at one time with COVID. And then in mid-December, we began to see hope, for that's when the vaccinations began. And finally, the mask mandates and other public health measures were lifted just a few short weeks ago. Now, throughout the course of the pandemic, we have measured where we stood by using some key data points. First, we looked at daily COVID hospital admissions, and you can see clearly the trajectory and the spikes in the virus on this chart. As I mentioned, it was in November where we peaked at 140 admissions in a single day. And through the course of the last 14 months, nearly 22,000 people have been admitted to task force hospitals in our region because of COVID. And that's a remarkably high number, but it could have been much worse. Today, we're just at 18 admissions across all of our task force hospitals. We've also carefully tracked the total number of people in the hospital with COVID throughout the pandemic. And you can see the same spikes in this chart. Again, the biggest spike started in late November and stayed in that range for a couple of months. As I mentioned previously, those were some very dark days where we were not sure how we were going to take care of everyone and how many people we were going to lose. In fact, I think the last time we gathered in this room was during that time. So today we have a total of around 100 patients hospitalized with COVID. But that's better than we've ever seen at any point in the pandemic. And we've always tried to mark the good news that has resulted from the great care that's been delivered with our healthcare teams. Since April of 2020, a total of 22,721 COVID patients have been discharged from the hospital and returned home. Getting those patients well enough to go home is what every healthcare worker strives for, even at those times where it seemed so desperate. But unfortunately, some patients didn't go home either. Since October of last year, task force hospitals have reported 2,147 deaths from COVID. Now that's an astounding number for this region. We have heard so many numbers about COVID, but the thought of losing more than 2,000 people from the St. Louis metropolitan area that would die from a virus in just a little over a year is sobering. This is also most likely an undercount of the total deaths that it can be attributed to the pandemic and shows just how deadly this virus is and continues to be. The arrival of highly effective vaccines and exceedingly safe vaccines has completely changed our fight against the virus. Now, when we began to vaccinate people in large numbers, we saw a dramatic decline in admissions and deaths. It was during that period that we were no longer playing defense and went on the offensive. The power in the pandemic had shifted. As of today, close to 1.8 million doses have been administered in our region. Just over 1 million have been first doses, and around 800,000 have completed both doses. So yes, we've come a long way. When we first began planning for the pandemic, we used a process mirrored after the military decision-making process. And in this process, before you begin planning, you establish what your end state looks like. In April of 2020, we said our end state would be reestablishing the vitality and vibrancy of the greater St. Louis region, characterized by three things. One, overall health and well-being with a substantial decrease in new transmissions. Two, the elimination of shelter-in-place orders, which we can now interpret as public health orders. And three, a reactivation of the local economy. And I think by every measure we've met our in-state conditions that we set forth in those early days of the Pandemic Task Force. Today, the war is not completely over, but the battlefield conditions have improved significantly, meaning we can move to a new phase of recovery. That means instead of dealing with relentless onslaught of the virus, we can now effectively manage the risks and the impact of the virus. We can now get back to a new normal, where we take the virus seriously, but it doesn't have to dominate our day-to-day lives. Like any war, the battle with the virus caused terrible losses in our region. Thousands died, thousands more lost their jobs, many businesses closed, some for good. And while we look forward to a return to normal, it's very important to remember what and who we have lost in this battle. Throughout this fight, the region came together. We didn't always agree on the next steps, but people are always working together to do what they thought was best for the region. And as you can see, we've made such amount of progress as a region. And while much has been lost, we have by and large avoided the worst scenarios that we thought we were going to see when this first started. All the hard work, the patience, the sacrifice made it possible for the region to get through the pandemic. And to talk more about where we stand now and what we need to do, I'd ask my colleagues and friends, Dr. Amina Akhtar from Mercy and Dr. Clay Dunnigan from BJC, to provide some perspectives.
Thank you, Dr. Garza. Good morning. I was asked to speak on what are the things that we can do today. But I think in order to understand that and appreciate where we are today, we need to go back over the past year and think about where we were. As a community, it was really more about the things we were not able to do. We were not able to go to sporting events. We were not able to travel. We were not able to dine indoors. What were we doing? We were learning how to give each other haircuts at home. we were picking up, home projects to do to keep busy. And more than anything, we were taking our elderly population, isolating them, hiding them from the world, trying to keep them safe from this pandemic. So let's forward a year later. The vaccine is here, people are getting vaccinated, and where does that put us? So think back to this weekend. Think of one thing that you were able to do this weekend that you were not able to do over the past year, and we need to appreciate that. So here's my example, and I'm going to tell you there's a mama bear story to this, a proud mama. So over the pandemic year, my 13-year-old plays indoor volleyball. I didn't get to go to her games because of visitor restrictions. This weekend, if anybody was outside, it's hot, 95 degrees, sunny. I sat through 7 baseball games of my boys. I watched my 8-year-old hit a 2-out, 2-strike, bases clearing double, and I watched my 11-year-old own center field. That would not have happened a year ago if we all had not been vaccinated. As a community, we're going to sporting events. We're going back to traveling. We are dining outdoors. We're back with our friends. We're back with our grandparents. We get to visit our grandparents. We get to hug them. Those are things that we did not have over the past year, and those things are happening now because people are getting vaccinated. Now, we're at a great spot right now, but we're not done. Because of the variants that are still coming in, because part of the population is still not vaccinated, that's not a good combination. So we need to remain vigilant. Vaccination will keep us where we are. So we need to make sure that we continue to stay alert and helping people get the resources to get vaccinated. A year ago, we lost a lot, and I think over that time, we've learned to appreciate where we are today. We've lost it once, so we really need to remain focused so we don't lose it a second time. Thank you.
Thank you, Alex. Thank you, Amina. It's a great moment to celebrate right now. Things are feeling much more normal than they were a year ago. We had a lot of fear and trepidation about what was ahead, and for good reason, it turns out. Over 2,000 deaths alone being one of the markers. But it's really too soon to let our guard down, right? We need to remain vigilant. We've got to look at the road ahead. Even now, we see what can happen. The flare-ups in northern Missouri and southwestern Missouri with case rates that are very high and a potential indicator of what could happen in other areas. And we'll come back to that in a minute. But the big question is, what can we do right now as we head into the summer to preserve the sense of normality we have and to get us on the road to a more permanent state? We are still learning about the virus. I think it's been about 18 months since the very first case reports emerged. And the amount of development and new knowledge in the interim has been extraordinary, both in terms of understanding the biology of the virus and, more importantly, understanding what we can do to prevent future infections. One thing we do know is COVID-19 is likely to be with us for a very long time. That would be particularly daunting if not for the development of the extraordinary vaccines that we now have that have safety and efficacy profiles that match the very best vaccines ever. The fact that COVID cases have come down is a gratifying indicator of just how well those vaccines work. So it's also a testament to the willingness and the stick-to-itiveness of our public health services, our health systems, health workers, to containing this virus and getting us to this point. While nobody can predict the future, there are some things we know. First of all, we'll in the fall enter once again our typical cold and flu virus season. It's a season that coronaviruses particularly follow, just like other viruses. And there is very good reason to think that that's the pattern we'll find ourselves in, that COVID-19, with all its various manifestations, will flourish again in the fall. And many things that we can do right now will prepare us to weather that likely bump up of case rates in the fall. One thing that's very important is the emergence of variants, and we've heard a lot about that. Variants have no doubt played a role in some of the biggest outbreaks we've seen, both nationally. I think the problems that were in Michigan, most recent problems on the eastern seaboard, were likely due to the emergence of variants. Variants emerge because they have some advantage over the previous version of the virus. In this case, the hallmark of variants has been greater transmissibility. that means they're more contagious. If you keep everything else the same and you bring in a virus that is more contagious than the one before it, more people will get sick. It's not enough to just hold the steady state. What we are looking at, if we fail to continue on the pathway to getting adequate vaccination in the communities, we keep the current level of social controls, which is very relaxed from what it was, and new variants such as the Delta variant that's really plagued India and Vietnam enter the market, we could see another very large spike in the fall. That's something I think none of us wants, and something that we need to do everything we can to prevent. By far, the most important thing that we can do for the future is to get vaccinated, to use one of the 3 vaccines that have now undergone very extensive testing. They have arguably had more doses given in a shorter period of time than almost any vaccine in history, and we have ample evidence that they are both effective and very safe. So there are very few reasons why people shouldn't get this vaccine. People who've been vaccinated, I'm looking around this room and thinking about how many people are not wearing masks, which was not the state we had last time we gathered. And it's a testament again to how these vaccines work. It's also a reminder of what normal feels like. So I think we're all looking forward to this being a permanent thing. We may reach a point relatively soon when the virus stops circulating. That's certainly what happens annually with influenza, with cold viruses. We go into the summer months and magically those respiratory viruses are gone. They're not part of our everyday fabric. I don't know whether we'll get there this year with COVID. We probably will in the future. Likely we're going to have to deal with coronavirus infections through the next respiratory virus season. But I would anticipate by this time next year we really will be at a place where the virus is not circulating. We can only hope. It's personally, it's been extraordinarily gratifying to be able to tell people that they can back off on wearing a mask, that they can spend time with loved ones. My wife and I recently took a trip to California to visit our 4 kids and 9 grandkids, many of whom we hadn't seen for 15 months, and that was great. That was a fantastic moment, and we're really looking forward to doing it again. But what made it possible then was aggressive control measures, including vaccination rates, which were starting to contain the disease. We do know that even as these variants emerge, they are still susceptible to vaccine-induced immunity. So we're optimistic that we'll be back out in California visiting our kids soon. But that course could be perverted if we are not careful about how we manage where we are now. We hope the worst of the pandemic is behind us. We want to do everything we can to prevent a new surge. It's nice to be on the side of letting your foot off of the brakes instead of putting it on. And we'll continue this ride toward normal, but there's probably no greater emphasis we can place than getting vaccinated. People who are not vaccinated place themselves at risk and place their fellow citizens at risk. So that's going to be the watchword going forward in preparing for what the future brings. Thank you.
Thank you, Dr. Dunnigan and Dr. Akhtar. I personally want to thank both of you, as well as Dr. Starkey from Mercy, who was with us when we first started off. Dr. Clevens, Dr. Campbell, thank you as well. You guys have just done an amazing job over the last 14 months, and I think on behalf of the people of the region, I want to thank you. You've been remarkable colleagues. And I also want to thank many others who have helped us get to this point, and many of those are the region's elected leaders that are with us today. So on behalf of everyone in healthcare in this region, I want to thank these elected officials who really worked tirelessly to deal with the pandemic. The war against the virus hasn't been easy, and people didn't always agree on the best solution, but time and again, elected officials were forced to make difficult decisions on behalf of the people that they serve, and they did. They came together. So thank you again for the leadership that you have shown throughout this historic time. And now we're going to hear from some of them. St. Louis Mayor Tashara Jones, St. Louis County Executive Dr. Sam Page, St. Charles County Executive Mr. Steve Ellman, Mr. Tim Brinker from Franklin County, and Mr. Dennis Gannon from Jefferson County. Thank you. Mayor.
Hi, good morning. It's a pleasure to be here with you today with Dr. Sam Page and my other county electeds from the COVID-19 Pandemic Task Force and all viewers who have tuned in throughout the region. On March 16th, 455 days ago, the city of St. Louis reported its first case of COVID-19. Since then, COVID has taken the lives of more than 500 St. Louisans and touched tens of thousands more. As we see the light at the end of the tunnel, I want to express my gratitude to all who helped us reach this point. Thank you to all of the healthcare workers, the doctors, the nurses, the caregivers who were on the front lines in this crisis. You put your own health at risk to help keep the rest of us safe. And thank you to the essential workers across this city, utility and infrastructure workers, grocery workers, janitors, delivery drivers, and the many who continue to work to provide essential services to the people in our region. And thank you to the members of this task force, which worked hard to keep people informed about the dangers and risks of COVID-19. And thank you to the residents of our region who socially distanced, wore masks, and stayed safer at home when it was necessary to do so. Together, we helped keep each other safe. But this pandemic is not over, and the only way that we can end it is by ensuring that our communities get vaccinated. I did my research, got the facts, and got myself and my entire family vaccinated. Vaccines are safe and effective in the fight against COVID-19, and I urge everyone who has not done so to do the same. Until you get vaccinated, wear a mask and protect yourself and others. Between April 6th and June 1st, more than 44,000 people were vaccinated at the Dome in downtown in collaboration with FEMA. And St. Louis will continue to work to get shots in arms. Starting today, our mobile vaccine clinics are out getting homebound residents and their caretakers vaccinated. If you need a home visit, call the St. Louis Area Agency on Aging at 314-612-5918, Monday through Friday from 8 a.m. to 5 p.m. And other good news, the City Department of Health recently earned a $200,000 grant from the state of Missouri to continue doing vaccine outreach and education. And many families are still struggling after the COVID-19 pandemic devastated our economy and forced thousands out of work. People across St. Louis need rental and mortgage assistance, small businesses need support, and our youth need programming to keep them safe this summer. We need to make sure our recovery from this crisis is equitable and lifts every neighborhood across our city, not just a few. So tomorrow, I'll roll out my proposal for the initial infusion of federal direct funds to get St. Louisans and residents and businesses the direct help and support that they need. I hope my fellow city elected leaders are ready to move quickly to get these funds allocated to the people who need them most. And I want our region to come back stronger from this crisis. We need an equitable recovery that reverses the decades of disinvestment. Thank you.
Hello, everyone. I remember sitting in St. Louis University High School auditorium in April of 2020. And I was there along with many of you and representatives of the 4 health systems as we announced a new pandemic task force. The surge was coming, it was announced, based on models of data the medical experts were closely monitoring. In St. Louis County 1 month earlier, I'd announced the first case of COVID-19 in Missouri. And by the time the pandemic task force was announced, we had 5 deaths in St. Louis County. The virus was moving quickly. People were scared. What is this new virus? What do we do to stop it? When the healthcare systems announced they were joining forces, they also announced that there would be daily briefings. Dr. Alex Garza, the Chief Medical Officer for SSM Health, would serve as the incident commander and would lead the briefings. The briefings brought together our top medical professionals to work through challenges together and keep the concerned public informed. The task force showed the power of partnership, the value of cooperation, and became a dependable, trusted voice on what was happening in the pandemic in our region. And the pandemic held a firm grip on our region for months. Dr. Garza and his steady leadership were at the helm. The task force was a reliable source of data for the difficult decisions that we had to make over the past year, and we were guided in a large part by these healthcare experts and those in our St. Louis County Department of Public Health. Dr. Garza helped break down the data to the public, who tuned in to the task force briefings to get the latest updates on how the region was being impacted by the pandemic. I've known Dr. Garza professionally for many years. His service to our country in the Army National Guard, his commitment to health equity and SSM Health has made it clear that we're lucky to have Dr. Garza on our team. And I can't leave today without expressing my deep gratitude for our healthcare workers. They made great sacrifices and risked their own health and their families' health to take care of us and our families during this pandemic. And as a medical doctor, I had the opportunity to take care of patients during the pandemic and to provide a bit of relief for those who went above and beyond, and then some, as our hospitals filled up with patients who were very sick with a deadly virus. Seeing firsthand the impact of the pandemic made it clear to me that our restrictions that we put in place to stop the spread of the virus in our community were good decisions, and that those decisions saved lives. And if you haven't already done so, please get vaccinated, and then go out and support our local businesses. Leave a generous tip for your server. Tell your vaccinated family and friends and loved ones from out of town to come to St. Louis. Use our hotels, enjoy our Midwestern hospitality. Go to a ball game, root for the Cardinals. They need a little help right now. Go to a concert. There's a new concert venue in Chesterfield called The Factory that is opening this summer, and they even have bands playing that I recognize. So vaccinated, we can do more safely. We can enjoy our summer. We can get our kids back in the classroom for in-person learning this fall. We can get back into our offices and get away from some of those Zoom calls. At the first task force meeting on April 4th of 2020, I believe it was Dr. Garza who said, we can all get through this together if we all do our part. Well, thank you to everyone who did their part. The sacrifices that you made for yourself and for your loved ones helped to keep us safe and get us to the point we are today. So let's keep it up. The virus is still in our community. Please get vaccinated. Thank you.
Hi, good day. Tim Brinker, Presiding Commissioner of Franklin County, Missouri. Thank you all for being here and spreading this wonderful news that we are sharing. That is wonderful in some cases, but not in all cases, because this pandemic task force has become somewhat of an extended family for some of us. I truly probably am the least educated on this group here, and it is ominous knowing the education that sits before me to my left and right, and it's an honor. But more importantly, I think it's been an honor to watch these people do what they do best, and that is serve the public and give great recommendations for what we needed to do at the time and at this time during this pandemic. So from Franklin County, Missouri, I say thank you. Thank you, Dr. Garza. Thank you, Dr. Dunnigan. Thank you, Dr. Ektar, and everyone on the board. Thank you to my fellow electeds, and thank you, the media team that's been assembled and reporting accurately in our region. Without that, people would be at home helpless, and we've witnessed it. Information has been key and always will be key to the success of any venture, and it's through that communication that we can become better and eliminate massive threats such as the one that we were about to crush. So thank you very much and have a great day from freedom-loving Franklin County.
I'm Steve Ellman, County Executive from St. Charles County. Dr. Page has related that meeting in April. But if you remember the first meeting, it was on a Sunday afternoon downtown St. Louis. I think everybody on stage here was there, and we were brought up to speed on what was going on. But what was really interesting is at that meeting, the CDC guideline was, I think, no more than 50 people in a room. And we all decided, yeah, we're going to do that. By the time we got to the car, when it was over, by the time we got to the car, the CDC had changed it from 50 to 10. And that's kind of, I think, set the tone for the next 14 months. Things were constantly changing. And I want to thank everybody associated with the Pandemic Task Force for the great job they did of making sure that us elected officials, people elected to make these decisions, always had the best available medical information to make those decisions. And yes, we didn't always make the same decision. And boy, we had a lot of great debates about what we should or shouldn't do, which I thought was healthy. Everybody had a little bit different situation, and everybody did things just a little bit differently. And now's the time, I guess, when the epidemiologists and the historians will start looking back, and I'm sure they'll find that we made some very great decisions in this region. Hope they don't, but they might find that there are some things we could have done better. But we will continue to go through that process. We've got people blaming just about everything on the pandemic. My favorite is Major League Baseball. All the people getting injured, it's because of the pandemic. I don't know about the players, but I kept working out even if it was at home. But there's going to be a lot of discussion. I will tell you that personally, as a former teacher, I'm most interested in finding out what impact this has all had on our children. And the educational opportunities have been different throughout the region. I hope I'm wrong, but I think the kids that had the opportunity for in-person learning had an advantage over some of those who didn't. And granted, not all those who chose to do virtual fell behind, and I can tell you as a former teacher, there's some kids that can learn without a teacher. But there's other kids that can't. And I just think we need to be very vigilant, and again, I hope I'm wrong, but we need to be very vigilant. We do everything to help those kids who fell further behind catch up in the next year or so, and that's the one thing that I'm going to be looking at the most. I not only want to thank the task force, my elected officials, really want to thank the people in my health department in St. Charles County. They did a super job. I want to thank the people of St. Charles County for listening to those healthcare workers when they were told to quarantine or to isolate. I want to thank those healthcare workers and the hundreds of volunteers that we had on our vaccination effort. We had hundreds of people volunteer, nursing students, medical people, retired, and because of them, we were able to vaccinate enough people. And at this point, I think we're still just a little bit ahead of St. Louis County. I think we're #1 in the area in the percentage of people that are vaccinated, but we're not stopping, and we're trying to get more and more people vaccinated. And again, I need to thank all those people that have made that possible. And also, thanks to you. Had a lot of people come out and interview us over the last 14 months. The questions weren't always easy, and there was some difficult times, but thank you for the job that you did of letting people know what was going on. Thank you.
Good afternoon. I'm Dennis Gannon from Jefferson County. I can't add a lot more other than, Alex, I'd like to thank you for riding the tip of the spear through this whole process. I hope that the spear is sharpened a little bit more because you were riding on it and leading it. And I remember the beginning of this when I saw the first vaccine given on TV, and I believe, Doctor, I think that was you that received it. To the very end, my dad, who's 96 years old, refused to get a vaccine until his 75-year-old nephew got very sick and almost didn't survive. So please don't let it take those kind of things to happen in your life to decide to do the next thing. I can't say enough for just the healthcare workers and the gratitude I have for them, as well as all the support staff who make all that happen. So just thank you for everything.
Thank you all so very much. As many of you have said, healthcare workers across the region have been on the front lines of this war since day one, and they willingly put their own lives at risk to care for patients during this unique public health crisis. They chose compassion over convenience. They chose service over safety. They cared for thousands of patients who ultimately lost their fight with COVID, and they did it with dignity and grace and determination. These healthcare professionals helped tens of thousands of patients live and recover. As a small token of our appreciation for those healthcare heroes, Diane Ray, Chief Operating Officer and Chief Nursing Officer of St. Luke's, has a presentation for the nurses from each of our healthcare systems. Diane?
Well, thank you, Dr. Garza, and good afternoon, everyone. It's an honor and a privilege to serve on the St. Louis Metropolitan Pandemic Task Force. As a member of the task force, I am so happy to be here today to say thank you to all of our frontline healthcare workers, our nurses, doctors, respiratory therapists, clinical dietitians, chaplains, and everyone who has given so much of themselves throughout this pandemic. I personally have been a nurse for over 40 years, and prior to 2020, the World Health Organization designated it the Year of the Nurse. I recall in the middle of 2019, a team at St. Luke's began planning ways to shine a light on the nursing profession. We never could have imagined what the year would bring and how much nurses would be in the spotlight. As we now reflect on the pandemic, it's sometimes easy to focus on the hardships and uncertainties that we faced. But I am personally grateful for how much we've accomplished together, and I've never been more proud of my profession than when I witnessed how all healthcare workers came together over the past year. Our frontline caregivers showed courage, selflessness, and resilience in the most difficult circumstances. They provided comfort to our patients, families, and each other during their greatest times of need. They did all of this while navigating extraordinary changes that happened at breakneck speed. These unprecedented challenges called for innovation, and our frontline healthcare workers rose to the challenge. Teams assembled to outline evidence-based practice patient care standards for a disease and a virus that we had never ever cared for before. Nurses laminated pictures of themselves to clip on the outside of their isolation gowns so their patients could see their smiling faces when they cared for them. They did all of this with colleagues who also had to put together new ways to help families communicate when they couldn't visit. We did this via tablets and videos and so many other ways to help our families and our patients communicate. We also witnessed the very best humanity of our community when our community joined together with the common goal of beating this virus. We were humbled every day by our community members' outpouring of donations in the form of homemade masks, meals, and sweet treats that helped us get through each and every day. The amount of gratitude and pride that I also share about the response from our region's frontline healthcare workers is really indescribable. Our healthcare workers were called upon ways that they never imagined. They adapted to changes daily, and even when they were exhausted and overwhelmed, they persevered. Our lives are all forever changed because of the patients that we cared for, the families that we cared for, and our colleagues that stood by our side each and every day. So while the Year of the Nurse did not turn out to go quite as what we had planned, the COVID-19 pandemic did bring to the forefront the bravery, compassion, and unwavering commitment of all nurses and all healthcare personnel. It did turn out to be a year in which all caregivers were recognized for their heroic efforts. And so now we would like to recognize our frontline workers who we have with us today. And first, from Mercy Hospital South, we have Kathy Booker and Andrea Schaefer. Both are nurses and clinical team leaders for one of the COVID units at Mercy Hospital South. And next, we have Lynn Crater. Lynn and I have worked together for a very long time. She is a nurse in one of our COVID intensive care units at St. Luke's Hospital. Thank you, Lynn. Next, we have Justa Davis, a clinical dietitian specialist at Missouri Baptist Medical Center. Justa. Next, we have Stacy Estes. She is a nurse on one of the COVID units at DePaul Hospital. Thanks, Stacy. And then we also have Sally Mackey, a chaplain at Mercy Hospital, St. Louis. Sally. These flowers are just a symbol of the love and appreciation that the St. Louis community has for all of our healthcare workers who have fought so brilliantly against the COVID-19 pandemic. Thank you all for everything that you continue to do and everything that you have done for so many members of our community. Thank you.
Okay, thank you all so very much. A couple of other things, and Tim, you kind of stole my thunder there. So I wanted to thank the news media for all the hard work they've done. You gave the people information. This is like the third time you guys have heard that. You probably don't get that much praise, but you really gave people information that they needed and that they could keep themselves and others safe. And you asked the important questions, and you were patient when we said we didn't have the answers. And I think your coverage made an important difference in helping us get through all of this. But mostly, and I think I echo what our elected leaders have said, I want to thank the people of the region. The citizens of the St. Louis region really showed the world what it meant to work together. You're resilient, patient, and consistent in trying to prevent the spread of the virus, and we were better able to withstand this threat because of your commitment. So thank you to everyone. But again, this bears repeating, the pandemic is not over. But we're in a very different place than where we were when we began these briefings back in April of last year. And as we return to that more normal way of life, we still have to be vigilant, and we have to continue to get more people vaccinated. Now, the virus is not going to completely go away, so our focus can't go away either. And as a region, though, we can manage this situation, and we have to stay ready to adjust if that condition changes. If the virus gains momentum, if there's a variant that comes out, we now know how we can ramp back up and combat the virus. So as we move on to the next phase of the pandemic, we're going to cease our regular media briefings. We'll still provide data from the hospitals, and if we see things changing significantly, of course, we'll adjust. But again, thank you to everyone who has played such an amazing role in keeping the virus in check over the past 14 months. You have undoubtedly saved lives and helped us get to that point. So with that, we're going to finish our remarks, and we'll take any questions from the media. I know that was a little bit long, but I appreciate everybody's patience. Thank you. Over the weekend, as I was anticipating this, I actually thought somebody was going to ask that question, and so that gives me a chance to dodge it. But let me just say it this way. I'm not going to give out a grade. I think everybody on this stage performed exceptionally well. I think, as Mr. Ellman said, we're still too close to this to figure out what we did right, what we could improve on. But it's like any complex scenario. You make the best decision that you have with the information that you have at that time. And I think by and large, most of the people up here did that. But really, and I'll just keep repeating this, the important thing, the most important thing to me is that we all worked together. And I think that was really phenomenal. So for that, for the cooperation piece, I'll give us an A+. How's that? There you go.
Dr. Dunnigan talked about this, the variant and how northern Missouri and southwestern, the Delta.
Yeah.
If we are going to see a surge in the fall, do you see it going back to where it was in April of 2020?
Well, maybe I'll ask Dr. Dunnigan or Dr. Akhtar.
So the question is, if we see a new variant emerge, will we be back to where we were earlier this year or at the end of last year? It's possible. I think the fact that we have so many citizens who've already been vaccinated really is going to blunt any rise we see. It doesn't mean we couldn't be back up getting hundreds of patients hospitalized, but we're also seeing some important trends in the data. The people who are being hospitalized now are younger because the older citizens of the region have mostly been vaccinated, and there's a really high proportion. So that will also blunt the impact in terms of morbidity and mortality in the population. That said, there is nothing that prevents us from having a major surge if we're careless with what ground we've gained.
Yeah, I think that's an important thing to point out too. And what we're seeing is the people that are hospitalized are the unvaccinated, almost across the board. And that just drives home the point that the way to avoid hospitalizations is to get vaccinated. That's how you bring that number down. But I think Dr. Dunnigan is right that it won't, the probability that we'll see the surge that we saw in the fall and winter of last year is much lower. Because the at-risk population has been vaccinated in high numbers, and so that's good. We'll probably continue to see cases, but we may not see that spike in hospitalizations or people being as sick. And I know Dr. Akhtar is part of the Mercy system is down in the Southwest, and they're experiencing a much different environment than we are right now, and that's most likely because of that vaccination percentage. Yes, Dan.
Dr. Garza, we have heard that the St. Louis Metropolitan Pandemic Task Force has become a role model for other areas of the country on how to respond to this type of challenge in dealing with the virus where little is known about it. Can you or the other medical officials talk about what you've heard from other cities and looking to St. Louis for leadership?
You know, Dan, first of all, thank you. We haven't really, I think we were so busy taking care of St. Louis and trying to figure out our own path that, you know, although we do communicate through our own networks in other parts of the country, I do think that it was unique that the healthcare systems and the elected officials and the business community and some of our other partners all came together to work on this. I've heard the same thing. I don't know if we're entirely unique, to be honest, and that's just because I'm not as learned about what other areas of the country are doing. But let me say one other thing, and that was early on in the pandemic, and then this is just giving a little bit of gratitude as well. I think the CEOs of the healthcare systems deserve a lot of credit for this as well. And so without their support and backing in driving this, I think it would have been, we would have been more challenged. But they absolutely, and Rich Lightwig from BJC, I think put it succinctly the other day when we were talking, and he said, you know, when we first came together, we checked our egos at the door, and we said, this is a once-in-a-lifetime event, and we all need to work together on this, and that was true. I couldn't ask for a more collaborative group of people to work with across the board, and that's what made this so successful. Yes, ma'am.
What is the long-term future for the task force? Is there a day where the numbers get low enough that it's expanded, or it continues?
Yeah, that's a good question. So the short answer is we're still trying to figure that out. The maybe more complete answer is, we're still going to collect data on COVID, on hospitalizations, things like that. Yeah, we think until it becomes more of a sort of steady state, and then it will sort of filter into like when we check flu numbers and things like that. We're a little bit cautious in saying that because of what Dr. Dunnigan said about we could see an increase in cases in the fall, things like that. So is one of the benefits or one of the outcrops of the task force was, and again, I'll give a little bit more gratitude to our analytics team. And so one of the other things that occurred during this is our data scientists and our epidemiologists came together from the 4 healthcare systems to produce those models that you guys see, to produce all the data that you see, to build the graphs, all of those things. And so it was, when you see us standing up here, know that there's like hundreds of people behind us that make us look good every day. And part of it is that analytics team. And they've become so good at this that they want to do other things now. So not just COVID things. And we're trying to think about what is the next thing that we can come together and work on. I know that they've been discussing it. We haven't landed on anything yet. I know we've been discussing it as well. We haven't landed on it yet, but I think we've shown the power of collaboration. And so we're looking forward to that discussion. Oh, sorry.
Out of curiosity, who came up with the idea to come up with the task force? Is it kind of a collective idea?
Yeah, I think so. Yeah, it was a collective idea, and so as Mr. Gannon I think knows very well from being in the military, the task forces, you focus on a task, right, and then it goes away. And so this was the task at hand, was the pandemic. And so it became clear once we came together that this is what needed to occur. I think the name we just sort of bantered about, and we had some help from marketing people and stuff, to come up with a fancy name. But yeah, it's rather long on the initials, though, so I don't recommend it. But yeah, it was a collective effort. Yes, ma'am.
Can you talk about, I think one thing that we all saw, it exposed the vulnerabilities of our public health system through this happening. With 2 of the leading research institutions here, what's being done for that next pandemic? The amount of research that's going on. And I realize it's a pretty broad question.
Yeah, so, and I do want to recognize Dr. Khan in the back of the room from St. Louis County Public Health, who's had to deal with the brunt of this as well. The state of Missouri is one of the lowest funded for public health in the union. And so when we talk about some of the challenges that we had in the pandemic, we also have to understand that this has been sort of decades in the making with the chronic underfunding of public health, and not just that, but other societal issues. And so oftentimes I'm asked, like, what would you do differently? And I'm like, well, we would have a more resilient community. There's no wonder drug that we're going to come up with, or perfect test that's going to figure this all out. I mean, the bottom line is, if we can become better as a community, and part of that is public health infrastructure, then we'll be better prepared for the next pandemic. There's no simple answer to a complex problem, but I do think that not just in St. Louis or even in the state, I think as a country we need to do a massive reinvestment in public health. I think there's no question about that.
Dr. Garza, could you speak to why it was important that the task force decided to increase the inclusion of our community-based health centers as part of the task force? They're not listed on the screen or on stage, but they definitely play a central role. Could you speak to that?
Yeah, absolutely. So our partners with community-based health really had the pulse of the community, right? They were engaged with especially groups that are at risk for the pandemic. And we recognized that there was no way that we would be successful in preventing excess, illness and mortality without having all of those partners at the table. And of course the FQHCs, the Integrated Health Network, is part of that. The Regional Health Commission, we knew that we had to have a very diverse slate of people at the table if we wanted to be able to get the entire community through this, in particular those at risk. And we also had the Regional Business Coalition and St. Louis Inc. were there as well to give that perspective from the business side. And so we tried to provide many different lenses to this very complex issue. It's not just a healthcare issue. It was a social issue. It was a cultural issue. It was an economic issue. It had many different things that I know all of our electeds, I mean, in some ways our job was easy. You know, we're concerned about the medical stuff, but the elected officials have to think about many different things when they're making their decisions. And so, yeah, it was important for us to have everybody at the table.
Has there ever been a collaboration amongst the St. Louis area healthcare systems like this in the past?
Not that I know of. Diane's shaking her head at me, and she would know better than I would. I think this was pretty unique. Yeah.
One more question.
Great Depression traumatized this generation a century ago. Most likely there's people that have been traumatized by this event. What kind of healthcare recommendations do you have going forward for people that experience still the anxiety, still the fear?
Yeah, I don't think that we're going to realize some of the second and third order effects of the pandemic beyond just the acute illness for years to come. Some of that will be on people that were infected. Some of it, as you heard Mr. Allman talk about, for education purposes. And I think also some of it is our healthcare workers. You know, I've said this before, in many ways, this will be their post-traumatic stress disorder. I mean, having to take care of many people that have died while taking care of them being the only sort of family that they had in the room, that is tremendously stressful for our workforce. And so going forward then, we have to anticipate that these are going to be issues and be able to provide that support for them, for the healthcare workers, but for other people, whether it's education, whether it's economic support. You heard the mayor talk about economic support for our communities. Across the board, we need to be understanding that this doesn't end you know, when that last COVID patient is discharged from the hospital. And in many ways, and you guys have heard me talk about this like war, it's the same thing. You know, the issues don't go away once you lower the flag and go home. The issues persist, and we have to be able to handle those. Okay, thank you all so very much. It's been a pleasure. Thank you.